Hi, my name is Alexandra Child, and I'm going to be talking today about tuberculosis. Tuberculosis has been around since ancient times. Tuberculosis was first found in Egyptian mummies in their spines. During the Middle Ages, people found tuberculosis in people's lymph nodes. Then during the 18th century, there was a huge increase in tuberculosis, and people started to call it the White Plague. Then in 1859, Herman Brummer created the first sanatorium, which is where people with tuberculosis went so that they wouldn't infect other people, and they would also get healthy food and a clean place to live to hopefully lessen the symptoms of tuberculosis. Then in 1944, the antibiotic streptomycin was discovered, which helped to cure tuberculosis. The problem with this antibiotic is that the tuberculosis started to become immune to streptomycin. So there have been later developments since then of different antibiotics that hopefully will not become immune to tuberculosis. People who have suffered from tuberculosis are Edgar Allan Poe, Emily Bronte, and Eleanor Roosevelt, all of which have died from tuberculosis. Tuberculosis is a bacterial disease. The bacterium that causes tuberculosis is Mycobacterium tuberculosis. The genus type is Mycobacterium, which means that tuberculosis is an acid-fast bacterium and it has a slow growth. Tuberculosis in particular takes anywhere from 15 to 20 hours to grow. Tuberculosis is a bacillus type bacterium, which means that it has a rod shape. You can see this rod shape in the background of this PowerPoint slide. Tuberculosis is non-motile, which means that it doesn't have flagellum to project it forward. Tuberculosis can be anywhere from 2 to 4 UMs in length. Tuberculosis is neither Gram-stain negative or positive. This is because it's a fast acid bacterium. It has a thick outer layer that is unlike other bacterium. This is why it can't be detected in Gram-stain testing, because it has glycolipids such as mycolic acid that do not retain the violet dye. Instead, the test that they use to determine whether it is a fast acid bacterium is called the Steele-Nielsen acid-fast stain test.
Hello, my name is Julie Blanco and I'm going to talk about symptoms and signs of tuberculosis. Signs and symptoms for tuberculosis of the brain, spine, kidneys, lungs vary depending on the organ it affects. However, there are multiple and similar indicators of tuberculosis presence. So first, a fever of over 100 Fahrenheit for over 10 days may be one of the first signs or symptoms of tuberculosis. Then coughing during 3 weeks or more is a huge sign pointing to tuberculosis. This symptom is related to the fact that tuberculosis causes bacteria to develop on the lungs, which creates this persistent cough that cannot be relieved by over-the-counter medication. Another symptom or sign is coughing or spitting up blood. This is a big indication that individual has contracted this illness. The chills. The chills are another sign of tuberculosis. Chill is when an individual is feeling cold and shaking without an underlying cause, with episodes as long as 16 minutes. This is a cause because the muscles expand and contract repeatedly. Then, as tuberculosis affects the lungs, chest pains appear and it may hurt when an individual breathes or coughs, causing it discomfort. The severity of pain around this symptom depends on how much the tuberculosis has progressed. Another one is night sweats. Night sweats can appear from the fever, the chills, or perhaps the virus itself. An individual may sweat right through their pajamas as a result of this symptom. Breathing issues, fatigue, and weakness are the things that patients complain more. Shortness of breath, making exercises, and even conducting normal day-to-day activities are difficult to do without losing your breath. And then, perhaps, it is the fever that comes into play, the discomfort around breathing, or the general feeling of sickness. However, those with tuberculosis will also suffer from appetite loss. This symptom is dangerous because the body without food do not function properly and do not keep all the systems running well. Finally, weight loss is another big symptom of tuberculosis. The amount lost is large, and most times the weight falls off without explanation. Often those patients who don't lose their appetite will also lose weight. Finally, any of the symptoms mentioned should not be taken lightly, and a visit to a doctor is highly recommended.
My name is Kendall Kern, and I had the reservoir and transmission for tuberculosis. For the reservoir, humans are actually the only known reservoir for the tuberculosis disease. Many researchers have tried to research and discover where it came from. A lot of them believe that it originated in Egypt, but nobody has been able to figure it out for sure. There are a bunch of random studies. When I found that was kind of funny. They thought it came from seals, and so they've been studying like marine life. No one's completely sure, but the only thing we are sure about is that the only known reservoir is us, as humans. For transmission, it goes through airborne droplet transmission, and I just have two examples of myself. One is sneezing, and another is coughing. Alright, so it's airborne transmission from droplet nuclei, and I have a little diagram that I made. So this person over here is infected with the bacteria, and so when this person coughs or sneezes or sings or shouts, the particles go into the air, and then someone else can breathe them in, and then that's when they'll become infected. So the particles enter the air, and then they will remain there for several hours, and that's when anyone who walks by or breathes them in will potentially become infected. And so how that happens is they'll breathe it in, and then it will travel down into their lungs, and then it will go into their alveolar sacs, and then that is where the bacteria will begin to multiply, and then your immune system will recognize the bacteria, and then it will come in, and it'll have the macrophages come, and they'll surround the bacteria, and a granuloma will form, and that's to keep the bacteria from spreading, but that granuloma will just remain there in the lungs. And 8 to 10 weeks from inhalation, the person could test positive for latent TB or pulmonary TB. Latent TB is where it's dormant and you aren't actually sick, it's just there in the granuloma waiting around. And pulmonary TB happens when the granuloma breaks, and then the TB bacteria will begin to multiply, and that's when the person will actually become sick, and they'll start having the signs and symptoms. And that actually can happen either immediately after they become infected or anytime later. And it typically happens in people with not very strong immune systems, so it could be young children or older adults or anyone who's been sick or who has been through chemo treatment. Anyone with a compromised immune system are likely to get active pulmonary TB.
Hi, I'm Lorinda Messick. My portion of the group presentation on tuberculosis is to discuss treatment and prevention options. Compared to other diseases and illnesses, the options for treating TB are minimal. Currently, there are only 10 medications used. The first-line agents include isoniazid, rifampin, ethambutol, and pyrazidamide. Isoniazid works at killing the bacteria, but the exact mechanism is not known. It is thought to prevent cell wall construction by disabling the bacteria's mycolic acid production, which is essential in wall structure. Rifampin works in a similar way as isoniazid, as it kills the bacteria by targeting the bacteria, then inactivates the RNA polymerase, a bacterial enzyme that is essential in protein production and DNA replication. As with all medications, these should be taken as prescribed from a medical professional. Stopping the medication before the treatment therapy is finished could be a potential cause of developing resistant TB bacteria, making future treatment much more difficult and can cause severe illness, even the possibility of death. Taking anti-tuberculin medications can produce unwanted side effects or adverse events. Some of the events that should be reported are anorexia, nausea and vomiting, jaundice, easy bruising or bleeding, and a number of other potential effects. A more severe but somewhat preventable adverse event is peripheral neuritis, a condition usually preceded by paresthesia of the feet and hands. Patients should have a liver function test occasionally to monitor SLT, ALT, and bilirubin concentration levels, especially those at high risk for hepatic complications. Isoniazid therapy should be cautiously used in people who drink alcoholic beverages, have chronic liver disease, severe renal impairment, or those who use illicit drugs. TB bacteria remains dormant until activated. The latent TB carriers aren't infectious, but some people pose a higher risk than others for bacteria to become active. People infected with HIV, an organ transplant recipient, an immunosuppressed individual, any person in close contact of individuals with recently diagnosed clinical TB, anyone with a monotox tuberculosin skin test induration reaction of 5 milligrams or more, any person whose chest imaging shows pulmonary fibrotic changes, and several others should be considered for treatment. Complementary therapy of pyridoxine at 10 to 50 milligrams per day can reduce the risk of developing peripheral neuritis. Peripheral neuropathy is damage to the body's nerves and can cause lack of sensation, body organ function, movement restrictions, negative gland functions, and other nerve damage depending on the site. Guidelines show the treatment of active tuberculosis cannot be a monotherapy. A multi-medication treatment is necessary for a minimum of 6 months with an initial intense therapy of 2 months. Adult dosages of up to 300 milligrams of isoniazid daily combined with another anti-tuberculosis agent such as rifampin at 600 milligrams is necessary. Then a phase of isoniazid and rifampin 3 times weekly. Pediatric doses from 10 to 20 milligrams per kilogram of isoniazid once daily, depending on the severity of the disease. The Center for Disease Control guideline for latent TB infection are HIV-infected people, as well as children, should receive a daily dose of up to 300 milligrams of isoniazid for a 9-month duration, and pregnant women need a bi-weekly dose for 9 months. There are specific ways to prevent the spread of TB. First, identifying people with active TB is crucial so treatment can begin. Treating latent TB, as discussed, is also very important for prevention. There is a BCG vaccine available, but doesn't cover all forms of TB. Treatment is used as a prevention strategy due to reducing the risk of a person unknowingly spreading the TB.